Meanwhile, India's government is urging people to self-isolate, but many people won't be able to do that as most houses in the country are just too small. In fact, having a personal room is a liberty in India. Let's delve further into this. The average size of an Indian household is 5. Over 30% of the Indian population live in a room. 37% of the Indian population live in a one-room house. Nearly 31% stay in a two-room house. Over 14% of the population lives in a four-room house. That's just 14%. Now, the percentage keeps declining as we move up the ladder. This as only over 2% of the entire population lives in houses with 5 or more rooms. That's the chart on your screen. And you can clearly see that the maximum percentage of population lives in a one-room house. For those living in India's poor localities, hygiene remains a big concern. Listen.
कोरोना का सर पूरा डर ही है सर. हर किसी के पास में सैनिटाइजर के लिए पैसे नहीं है कि हर इंसान सैनिटाइजर लेके चले. या तो सर कुछ इसके लिए प्रावधान किए जाएं, हर जगह पे थोड़े नल लगाए जाएं या फिर साबुन या फिर सैनिटाइजर रखे जाएं तो उससे रोकथाम हो.
पता है कि वायरस फैले हैं तो इसे कैसे कैसे करना चाहिए. तो अपन हम लोग गरीब गुरबा क्या करते हैं कि साफ सफाई, कपड़ा नाता, घर द्वार सफाई रखते हैं, नहाते धोआते हैं. और कुछ गरीब लोग क्या कर सकते हैं भैया. कहीं जाते हैं तो जैसे कि ऐसे मुंह पर जैसे रुमाल चाहे कुछ लगा के ऐसे चलते हैं.
We also spoke to Professor Ramanan Lakshminarayanan, a director of CDDEP and founder of Health Cube, for more insight on this. Listen.
826 samples is simply too small to find COVID in a country the size of India. We're talking about a nearly 1.4 billion population. Even if the COVID prevalence were at 1%, which means that something like 13 or 14 million people had the disease, it is not sufficient to do a test on 820 people. That is not a reflective sample at all. If the prevalence were 50%, then 820 is enough. But at this level of prevalence, the number of random tests that they should be doing on people with respiratory symptoms should be more like 50 or 100,000 people, not 800 people. I don't have direct evidence of community transmission. All that I'm saying is that ICMR not finding evidence is not evidence of absence. It just means that we haven't looked hard enough. Without a doubt, let me explain. This virus has a long incubation period, which means 2 weeks is how long it takes. You can get an infection and then actually it shows up only 2 weeks later. So it progresses very quietly and takes a fair amount of time. And then when it hits really fast. So we are in the same situation that the US was maybe 2 or 3 weeks ago. And you've seen that the United States went from 2 cases or 3 cases up to now, I think they've crossed 7,000 or 8,000 cases already. It happened in just a couple of weeks. So we should be prepared for that kind of a ramp up, especially when our testing goes up.